welcome, Professor Rajagopalan, and thank you so very much for talking to us about an important issue today. We're all interested in the distribution of the vaccines for COVID, but I know that behind the scenes, just getting the vaccines built, assembled chemically, and all the supplies goes into distributing them, and as well as making them. You've got a big topic today.
Well, thank you very much, Jerry, and thank you all, Jeanette, for coordinating this. And this is a great opportunity. I appreciate it. I've been at USC for almost 33 years, so it's nice to talk to a group outside Marshall and outside sort of my community. So let me, and I'm going to, given the diverse audience, I'm going to try and keep this as broad as possible. And at the same time, here and there, I'll touch upon some research that, can inform some of these decisions. So let me start. So I'm going to talk about sort of COVID-19 and supply chains, but I'm going to talk about not just vaccines, but also some of the other supply chains for other products that have been impacted in one way or another by the pandemic. Okay. So in the past year or so, we have seen numerous news headlines, and I am assuming you can all see my slides clearly, and feel free to interrupt me at any point. You don't have to wait until the end to ask questions. Please feel free to share any questions, any comments, happy to respond. So we have seen numerous headlines. If you just look in the last 2 days, yesterday, I saw an headline saying there's going to be a 90% drop in J&J vaccines coming to California. And 2 days ago, there was lots of appointments available in LA County at one of the East LA sites. And then kind of changing topics, this is vaccines. There was a recent article about how a chip shortage, and this is silicon chips, has impacted adversely the manufacturing of cars. In fact, GM just recently announced that they're going to stop production of some of their cars for the next 2 weeks because of chip shortages, which are related to the pandemic, as we'll talk about in a moment. Same thing with phones. And if you go back further, you may recall in March and April of last year, there were lots of articles in the news about ventilators and how there's a shortage of ventilators. They're struggling, New York State in particular. And then it turns out, if you read a December 2020 article, the US spent a lot of money on stockpiling ventilators that were never used. And many of them, even the ones that were used, couldn't have saved some critically ill COVID-19 patients. I'll get into that a little bit. And some of these I'll go in a little bit deeper. And then there is the testing. And then there were delays in testing, if you recall. Right. And some of that had to do with, again, supply chain issues. So in all of these cases, there was some supply chain issue, right, that led to some of these problems. Similarly, fresh produce was going to waste, milk was going to waste, right, while there were shortages of milk in some locations. And so to some extent, we want to try and understand, why is it, on the one hand, we see shortages, but on the other hand, we see some excess supply, right? So this naturally, when you read all these news items, the average person, right? And then this was again from last week, this is Light LA Port. You can see supply bottlenecks leave ships stranded and businesses stymied, right? So it stretches everywhere. And then this, in the minds of all of us, this raises a lot of questions. Why do we see unused vaccine doses in one location, but then appointments canceled due to lack of doses at another location, right? And then why were there shortages of foods, household essentials, medical supplies, right? So these are the problems that we see, either shortages or excess supply, okay? Now, it is the shortages that mostly make the news. Excess supply rarely makes the news, right? But there were many instances where there were excess supplies, whether it's ventilators, whether it's masks, etc. Okay, it's just that you have to search hard to find that. The question is what can organizations do to better manage supply chains, whether these be public health organizations or corporations, right? And to some extent, what can we do to make supply chains more resilient to disruptions? And another thing to keep in mind while we think about these disruptions is it's not enough to think about just response. You also have to think about the cost, right? In some cases, we don't want to think about cost, right? But to some extent, cost matters, to a corporation, right? And then will the pandemic result, if time permits, we'll get into the pandemic result in long-term changes to supply chains, right? Will they become more localized? For instance, will there be more production, more manufacturing in the US, right? Because that's another question that's been raised in many cases. As I showed you in a headline earlier, with masks, there was a shortage and people said, well, it's all because they're made abroad, right? And we'll get into that. I'll show you some data. Hopefully we can understand some of these issues in a more objective, right, manner rather than sort of just subjective anecdotal evidence, okay? So let's start with some very basic understanding of supply chain, okay? So the objective of supply chain management, right, and we're kind of going to go through a few fundamentals here, okay? The objective of supply chain management is to sort of match supply and demand, right? But in a timely and cost-effective manner, right? So the timeliness is important because we want to get it on time, right? I've got supply, but it comes 2 days late or 3 days late, like a delivery package coming 3 days late, right? That's not timely. But at the same time, we also have to think about cost effectiveness because everything costs money, right? And somebody pays for it, right? Either the taxpayer or the consumer pays when the cost is high. Okay, so you have to think about cost effectiveness. But there are situations where we might say timeliness is far more important than cost. There are other occasions where we may say cost is more important than timeliness. Okay. Now let's think about what happens when supply is greater than demand. In a very simple way, all we have is excess inventory or a stockpile. On the other hand, if supply is less than demand, we have shortages, right? That's straightforward, simple. The question is, why do supply-demand mismatches occur in the first place? Well, there are many reasons, and we're going to go into it over the next 20 minutes or so. But the most fundamental reason supply-demand mismatches occur is because either demand is uncertain or supply is uncertain, or both are uncertain at some point in time. These are not the only reasons, but that's the fundamental reason. But that doesn't tell us a lot more. Yes, it's uncertain. The question is, some of these things are controllable. That is, the uncertainty is because of things that we do. That is the organization which manages, whether it's public health or corporation or consumers, right? Create this uncertainty, or suppliers create this uncertainty. So that can be managed, that can be controlled. That's where the opportunity for improvement lies. Some of these supply-demand mismatches are more difficult to control, right? And let me start with a simple example, and we'll go into this some more. For instance, when people think there are shortages, immediately there is panic buying, right? And hoarding. That's the source of uncertainty, because then the company or the retailer does not know how much more demand is going to increase. And that creates shortages, right? We'll see that, we'll go into that a little bit more, but that is something which is more difficult to control because you cannot anticipate easily how much people are going to overreact, how much people are going to hoard, right? So it's easy to say, well, people shouldn't hoard. Well, that's more difficult to control. Let's think about the things we can control that we can manage better, okay? And I'm going to focus more on that when we think about how can we improve supply chains, okay? So now let's go a little bit deeper into the supply-demand mismatches, okay? So when we think about supply-demand mismatches, what makes them more likely? We look at both the demand side and the supply side. Let's start with the demand side. Well, first, demand fluctuates. What do you mean by demand fluctuates? Firstly, demand is seasonal, right? It varies by the day of the week. People shop on certain days much more, so demand fluctuates. And you have to anticipate that. If you don't anticipate it, there are going to be supply-demand mismatches, right? If I keep only 5 units of inventory on a shelf, but the demand that day is going to be 10, I'm going to have a shortage, right? And on some days, demand is going to be much more than on other days, right? More people are going to show up for vaccine appointments on certain days than other days, depending upon when they're more free, right? If they're working on weekdays, there's going to be less demand for that, right? On weekends, there might be more demand. Some of that one can anticipate and plan for, but some of the uncertainty you cannot anticipate in terms of demand fluctuations. And as I pointed out earlier, there could be also things like panic buying, etc., right? Or people can make, with regard to vaccines, multiple appointments, right? Because there are so many different places where they can make appointments. And what do? They go to only one of the locations. And what does all the other locations think? There is going to be demand, but in fact, there is no demand, right? That leads to vaccine excess supply because demand turns out to be less than supply. Now, those are the simpler ones. Let's think about what I mean by multiple demand locations or demand streams, okay? So let me give you 2 examples to illustrate this by one, the multiple demand locations. With vaccines, we can do the following, okay? I'm just going to give you a simple scenario to understand this. One is, we can simply say we are going to have one location where we distribute vaccines in every single city, right? Small city. And if it's a large city, you will have multiple locations. But let's say in a neighborhood of 10,000 people, and we can define those neighborhoods. Every neighborhood of 10,000 people, I'm going to have one location, okay? On the other hand, and that's the only place where the vaccine is distributed. On the other hand, let's imagine a scenario, the current scenario, where you can get the vaccine at a local pharmacy, you can get the vaccine at mass distribution points, which are run by the city, which are run by the county, which are run by the state, which are run by FEMA. What happens when you have lots and lots of demand locations? Then what does one have to do? What does the organization which manages have to do? You have to forecast then demand at each one of these locations. And it becomes far more difficult to forecast demand at every location when you have many locations. And if you have many locations, then even if you did everything the same way correctly, the supply-demand mismatches are going to increase, okay? So the moment you say, I'm going to distribute through many pharmacies, many locations, right? Inevitably, supply-demand mismatches will be worse. It doesn't matter how well you manage it, doesn't matter how much inventory you have, your supply-demand mismatches are going to be worse. And when I say mismatches are going to be worse, you can end up with excess supply, or you can have very little supply, okay? Or you can have vaccine doses. And I'll give you simple examples based upon just what I've heard from family, friends, etc. There's a small pharmacy in Glendale that says, oh, we got supply, because nobody's going to that pharmacy. And then you go online to the vaccine distribution site, and then you look at all the CVS and Rite Aid in your area, and there is no demand. There are no appointments available. But a small pharmacy has. Why? Because of supply-demand mismatches, okay? The other example is what I call demand streams. And this was borne out to us in numerous ways earlier in the pandemic. Let me give you some examples. You may recall there was a toilet paper shortage. And some of that was because of things like panic buying, etc. But some of it was simply the fact that demand stream had shifted. What do you mean by that? People spent all their time at homes. They were not in offices. People consumed toilet paper both in offices and in homes. There was a lot of supply in the supply chain that being distributed to offices, but there was no supply, right? But there was no demand there. And so there was excess supply there. And on the demand supply chain stream, what happened? Demand went up, but the supply remained the same. So we had a supply-demand mismatch. Same thing happened with many food products, milk, beer, right? Restaurants, nobody was going to. So the demand there plummeted, but the supply in the supply chain was still existed. Demand at homes increased, but the supply chain was not ready to supply that yet, right? Because they are not adapted. And remember, even the type of products that are sold to these different streams by the same toilet paper company or the same beer company is very, very different. So they have to change the packaging. They have to change the size of the product, right? All of that is not easy to do in the short run. But you can see how it's the same product at a generic level, but you have different demand streams and demand fluctuates and leads to supply-demand mismatches, right? And then the greater the variety of items, right? And by the way, that is still continuing to this day. If you just read last week, there was an article about how ketchup, many restaurants don't have enough ketchup packets, right? That's again a case, an example of supply-demand mismatches, because to some extent demand. And again, we are going to see changes in the demand streams in the coming weeks and coming months as we return to normalcy, and you'll have more of these kinds of supply-demand mismatches, okay? And this also happened with things like greater variety of items. The more types of packaging that you have, right? Whether it's wipes or toilet paper or any other item, the more types of packaging, small packs, big packs, large packs, bulk packs, the more the variety, the more you're going to have supply-demand mismatches, because again, it's the same point, the multiple demand location, multiple demand streams, greater variety. I have to forecast demand. If I'm a manufacturer, or if I'm a supplier, or if I'm a public health organization, I've got to forecast demand for every single of those items in the size of packaging, the size of product, the type of product for every location. And we are talking about hundreds or thousands of such locations. And that becomes difficult because you cannot forecast accurately, right? Because your forecasts are going to be inaccurate because there is uncertainty in demand. And then finally, what makes these things worse is panic or hoarding behavior. But this is more difficult to control, whereas these, to some extent, you have some control. For instance, if I decide that I'm going to distribute vaccines more centrally, where I have so many locations for every 10,000 population, only one location or two locations, whatever it might be, whether it's a population of 10,000 or 5,000, whatever it is, supply-demand mismatches are less likely. You're going to have much better. And I'll illustrate this with a simple example in a little while, okay? So these are on the demand side. Now let's go to the supply side. On the supply side, supply-demand mismatches are more likely when you have what are called long and uncertain lead times, okay? So there are a number of reasons. I'll go through each one of these in a moment. Let's look at long and uncertain lead times, and I'll show you a simple example, and I'll come back to the slide, okay? And this example that I'm going to talk about deals with silicon chips, okay? And what we have heard recently is that silicon chips have been severe shortages over the last few months, okay? And I'm going to show you a supply chain for silicon chips. So there's a company called Taiwan Semiconductor Manufacturing Corporation. Most of their foundries are based in Taiwan, right, and China, and some other countries in Asia. They produce chips which are used by companies such as Qualcomm. These are the chip manufacturers, the chip designers. These are the chip designers, right, which are all US companies, but TSMC makes it for them. They do the actual manufacturing. And these go into, as you can see, the end products, which are phones, computers, right? And also, as you can see, automobiles, consumer electronics, household appliances, right? So you can see a lot of end markets that all use chips. Now, what happened is demand for electronics increased dramatically, right? As demand for electronics increased, chip demand increased, and chip capacity was limited, right? And this led to shortages. And in fact, when there are shortages, what happens with products like this? This is not a commodity. With commodities, when there are shortages, prices go up. These are not commodities. These are designed for specific customers, right? And so prices cannot change in the short run because these are long-term contracts. So what changes are lead times, right? And here is a chart that shows you what's happened to the lead time. So the y-axis here is the lead times, and this is between 2017 to now. And you can see how lead times for chips can change dramatically. And you can see what happened starting around this period. Lead times increased by 15 weeks. Increased to 15 weeks. Okay. So when lead times are that long, and what does lead time means? The time between when I order and when I got the item, when I get delivery, right? And when lead times are long, what happens? I, as a manufacturer, have to plan 16 weeks in advance what I'm going to produce, which means that I've got to forecast demand for my products, which are the automobiles, which are phones, which are computers. I have to forecast that demand for those products 16 weeks into the future or 4 months into the future. And that's not easy to do, right? And so what's going to happen when I have to forecast into the future? My forecasts are going to be inaccurate. And when forecasts are inaccurate, what am I going to end up with? Either excess inventory, if demand turns out to be less than supply, or shortages if demand turns out to be more than supply. And this is what happens again and again. And what do you think is the reaction if, let's say, lead times increase? What do you think you would do? If you were, let's say, a buyer and demand increased dramatically and lead time is uncertain, what do you think you would do? What did people do with toilet paper? They overordered. They bought a lot more toilet paper than they needed. What do you think happens when you overorder? What happens to lead times? They increase even more. And what happens when lead times increase even more? You order even more. And this becomes a vicious cycle. Unfortunately, this has happened in electronics multiple times. So this happened, believe it or not, because I've taught this and I've seen it over the years. It happened in the 2001, 2002 period when there was dramatic increase in technology stocks and technology products. It happened again in the recession, 2008, 2009, the Great Recession, when demand plummeted and then started increasing. And then it's happened in the past year. Okay, so you can see when you have long and uncertain lead times, that leads to enormous supply-demand mismatches. Okay, and that becomes worse when supply chains are global. When supply chains are global, lead times are longer, right? And this is true for apparel, this is true for many products. And that certainly leads to more uncertainty. When the product is made up of many different parts, so if you think of an automobile, which is made of many, many parts, what happens? There's lots of variety. And when there's a lot of variety, you got to forecast demand for each one of those parts. And inevitably, what happens? Supply of some part, there's a shortage. So think of General Motors, what's going to happen over the next 2 weeks for General Motors. Because of a chip shortage, they'll have to stop production. But all the other parts that are going to an automobile, that supply chain is still running the same. And so you're going to have excess inventory of those products. You have a chip shortage, but you got excess inventory of all those other raw materials, whether it's rubber or tires or steel, etc. So you can see how the more parts it's made of, the more uncertainty. All it takes is one item, something goes wrong, right? Another source of uncertainty is multiple supply sources, right? And just like we have multiple demand locations, we can have multiple supply sources. Now, what do we mean by that? What did we do with vaccines, for instance? We said, well, we'll supply vaccines to hospitals. We'll supply vaccines to pharmacies. And then we changed course and said, well, we'll let Blue Shield manage this, right, in California. Now, what happens then at the county level? There is more sources of uncertainty because you have more supply sources, right? And the more supply sources, let's imagine that all the vaccines come from the manufacturers to the state, right? We don't know all the details, but let's assume that. And let's say the state allocates it to individual counties, individual hospitals and hospital chains like a Kaiser or Sutter Health System, etc. And then they also, let's say, allocated to pharmacies. what happens now? I've got to somehow make the correct allocation to each one of these supply sources. And what would that be based upon? They will make some forecast and tell me I need so much. Inevitably, what's going to happen when you have many supply sources, one of those is going to go wrong, right? Some of those supply forecasts will be incorrect. And so what happens? Some of them will end up with too much supply, and some of them will end up with very little supply, okay? And this happened recently. If you look in Northern California, Contra Costa County had plenty of supply, and they expanded the vaccine eligibility to everybody, right? In March, this was in March, they expanded it to a much larger population. At the same time, Santa Clara County was canceling appointments, 5,000, 10,000 appointments almost every week. Just 30 miles away, 20 miles away, right? So you can see how supply-demand mismatches lead to enormous differences in the experience of different counties, right? And then on top of it, there are some things which are just hard, like uncertainty in supply. Now, we have seen just in the past week, J&J vaccine, the supply is going to go down dramatically. Why? Because there was a problem in the plant, right? There was an error in mixing some ingredients. They produced product, turned out the product was defective and cannot be shipped. And we're talking about millions of doses, right? So that's an example of supply uncertainty. Similarly, there can be, if you recall earlier in the pandemic, many meat processing plants were shut down because of spread of COVID, right? That's a source of supply uncertainty. Similarly, if you look on the product side, there can be strikes at a port, right? LA port has been shut down in the past because of strikes. So you can have any number of supply uncertainty that can shut down, create uncertainty in supply, not on the demand side. And then there can be poor procurement or replenishment policies, okay? And this is where, to some extent, it depends upon, a particular ordering policy, which is that how much should I order? Should I order, 100,000 doses or 200,000 doses or 150,000 doses, right? We've been constantly hearing over the past 3 months of, oh, we don't have enough supply, right? But the question is also, was the proper amount ordered? And the proper amount ordered depends upon taking into account demand, right? What the lead time is. And it's not clear. In this case, we are not sure if good policies were, and I say this partly because what I have read, which is not in the general news media, but in some sort of more specialized media, what I have read is that there was not always, sort of good replenishment policy. So there's a lot of research in this area. This is one of the areas that I have done research in myself, where you can come up with mathematical models that can be used to determine how much should I replenish every week or every day, right? I've helped companies do this, and now there are lots of companies that have developed specialized software that can be used for this. It's not clear to me any of this is being used by public health organizations. Large companies routinely use these models, but it's not clear that public health organizations are using these, okay? And I say this partly because in August of last year, I participated in a panel discussion. This was at the California, that was organized by the California state. And there were a lot of people there, for instance, there was an assembly member who was in charge of, sort of health planning on the assembly side. And there was a state senator from the state Senate side who were all, involved in this, in planning for the pandemic. And there were a lot of important policymakers. Interestingly, the state treasurer was there, everybody was there. Interestingly, there was nobody from the California Department of Health, right? And the discussion was all about supply chain and COVID, right? And so it would have been useful to have somebody from the Department of Health so that we can see that they would, so that's one of the things that, that's why I said, I'm not sure how much good procurement, sort of because there are sophisticated policies that companies follow. If you look at a company like Amazon or they follow extremely sophisticated replenishment policies, right? The best of the best, the cutting edge. And some of that can be easily followed by our public health organizations. And then sort of inadequate planning and forecasting. We saw this with testing. We saw that with the vaccines. And then finally, limited production of transportation capacity, right? We have, I don't know if you've been aware, but in the past few weeks, many ships have been stranded outside Los Angeles port because the port does not have the capacity to process the containers that are coming in. Okay, they don't have adequate capacity. So this is something that, so you can see how limited port capacity and sometimes can be limited production capacity, right, can also impact these things. So let me talk about now, what can we do? Better supply chain planning, the objective, you can have two objectives that can sometimes be in conflict. One is responsiveness. How quickly do we want to respond? We want things to be available, right? But sometimes this goes against efficiency or minimized cost, right? Why is that? Because I can have a lot of inventory, but then it's going to cost me more, right? But then I'm very responsive, okay? Let's delve into this a little bit more, okay? What can organizations do to achieve better supply chains? One of the important things is reduce the number of demand locations, okay? Which is, and I'm going to show you a simple example just to illustrate the point of having one versus many locations that I mentioned earlier, okay? So let me show you this example. Imagine we are talking about, let's say, vaccines, okay? And let's suppose I have 5 locations, okay? And let's suppose I had initial inventory of 100, and this is the demand on each day, which is uncertain. I don't know what the demand is going to be, but let's suppose this is the demand that transpires. And you can see it fluctuates wildly. The demand fluctuates between 0 and 60, averaging 30. And let's suppose at the beginning, I have 100 units of inventory. What is going to be the ending inventory on the 5th day at the end of the week? Basically, I took this 100, subtracted all of this, and let's suppose there is no replenishment. It gets replenished only once a week. I end up with 3. At Alhambra, I end up with 23, right? Basically, it's 100 minus all of this, I end up with 23. At Culver City, I end up with negative 21. What does that mean? I have a shortage. Here, I ended up with excess inventory. Here, I ended up with a shortage because demand turned out to be, and I could not have anticipated this, right? And here again, you have a shortage. Here, you have excess supply. What happens instead of these 5 locations? Let's suppose, and this is just for example, I'm not suggesting that we only have one location, but this is just to illustrate the point, right? Suppose I had only one location where all these people came, right, to come for vaccines. Okay. Now, this 95 is nothing but all of these added together. This 107 is nothing but all these 5 numbers added together, and so on. What happens in this instance? I don't have any shortage on any day. What happens here? The people in Culver City and Bell Gardens will be screaming, say, hey, I went for the vaccines and I never got any doses. Here, we're going to have excess supply. But what happens if it's more centralized? You're going to have less of these supply-demand mismatches. Okay? This is not to suggest that we have one location in all of LA. You can have many, many locations, right? But if you have too many locations, right? Every little pharmacy, every little clinic, you're going to have inevitably supply-demand mismatches and a slower rollout of the vaccine. So if you recall, if you go to like LA Times or New York Times and you see the tracker, you will see a tracker that says, right, how many doses have been administered of the supply that's available. And, California right now is at about 76%. Okay. Why is it only 76%? Partly because of these supply-demand mismatches. Right? That's precisely why that happens. Okay. So you can see that helps a lot. The other important thing is visibility into the supply chain. I cannot emphasize this enough, right? One of the biggest challenges that almost every state has had in this country, which is very surprising to me in 2021, we are not in 1995 and 1984, is how California does not have visibility into what is the inventory, right, at every location of vaccine doses. Now, when it comes, remember, we had a very similar problem with ventilators earlier. We had a similar problem with testing. We don't know how many tests were being given, etc. One can understand at that point in time because it was early in the pandemic. We didn't have time to plan. But with vaccines, we had almost 8 months to plan, right? And so when you had the time, what should have been done? We should have set up a phenomenal information system in the country where we know ahead of time where we're going to give vaccines, and we can keep track of what is the demand at every location, how many doses are being administered, and what is the inventory that's available. Because if we know how much inventory is available, how many doses, what can we do? If necessary, if demand turns out to be very low in one location, we can move that supply to some other location, right? So visibility into the supply chain is critical. And this is something companies have had for a long time. Just to give you an idea, Walmart had satellites tracking the amount of inventory and demand at every one of its stores by 1978. 1978, that's more than 40 years ago, they had satellites tracking the amount of inventory. If we had asked Amazon or Walmart or any of these companies to do this, they would have set up the entire information system so that we had visibility into vaccines in just a few weeks, because they are set up for this, right? Amazon is a cloud provider. So that enables you then to transfer items across locations, right? And so just doing these three things will dramatically improve something like vaccine distribution or something like testing, okay? And then if in some cases, and this is not with vaccines, and in fact, the vaccine problem is a very simple problem. Why? Because we have one product. Companies normally distribute hundreds and thousands. A typical Walmart has 40,000 different items, right? And they somehow manage the inventory of all those items quite well. With vaccines, we're talking about one item, right? Essentially, we have three products, but typically any one is managing one of those, okay? So reducing variety makes also supply chain planning much easier, okay? What can organizations, other thing is better procurement replenishment policies that I mentioned early, if possible, hold inventory more centrally rather than many locations. And then certainly production within the US will help a little bit for critical items, right? Critical medical supplies. Why? Because then you can respond more quickly. Because anything that's produced far away, the lead time increases. And having some excessive production transportation capacity, as we talked about earlier, also helps in being able to be more responsive. The cost will go up. When you do these two things, the cost will go up because it's more expensive to produce in the US and excess capacity costs money. But you have a quicker response. And that is needed for something like medical supplies. Okay. And then we want to be able to monitor information and material flows. And then finally, one of the things that we have not done is simulate supply chains and stress tests. So for instance, with critical medical supplies, knowing that a pandemic can occur, you can do a stress test. You can say, well, if there is a pandemic, if demand increased, do we have the inventory of masks, ventilators, other things? And can they be produced fast enough? For instance, if you look at the economy, money supply, the Federal Reserve does a stress test of banks all the time. Similarly, you can do stress tests of supply chains, right? And to some extent, organizations do this. If you look at Intel or any of the supply chain companies, they all do this, the big retailers, okay? And you can do supply chain stress tests for medical supplies, okay? Now, let me just talk briefly about medical device supply chain. Many items were produced from across the world, whether it's X-ray equipment, patient monitors, breathing masks. And typically what happened, demand was much higher than normal with the pandemic and combined with long lead times. And the supply chain disruption was substantial, not just in the US, but across the world, okay? And here's a little picture. I don't know if you can see this very clearly, but this just tells you that many things are produced in the US, but they are also exported and imported the same item. Okay, so it's not as simple as saying we produce in the US or we produce abroad. Many things, whether it's respirators, whether it's sanitizers, whether it's protective garments, right? They are both imported and exported depending on the item. Typically what happens with most of these items is the higher end items, the higher end models, the more sophisticated models are produced in the US and exported. The lower quality, the lower end, the lower price items are produced abroad and imported, whether it's masks or whether it's ventilators. Okay. And so you can see, and the reason I mentioned this is because you can see how sometimes we do it from a trade point of view, and that has an impact. And this picture illustrates that. We put tariffs in China, and guess what happened? Respirators, masks, and gloves from China declined, but respirators, masks, and gloves from the rest of the world increased imports, right? And so, but they are still not produced in-house, they're just imported from other countries. So lead times didn't change, right? And so you can see if lead times don't change, that you still cannot benefit from a supply chain point of view because lead times are still long, right? Instead of China, it's some other country abroad. So lead times are still long. And so it still impacts you adversely if it's not in the US. Okay. And so you can see supply chains are global. They are going to remain global. It's going to be hard to change that overnight, but certainly for critical items, it's good to have some of the supply chains in-house or local. Okay. And I want to briefly talk about this because I was heavily involved in this in March, April of last year. Because I saw all these news reports about ventilator shortages. So I did a little bit of research into this for about a month. And it turned out, here's an interesting point, which is that New York was, and some metropolitan areas were expressing a lot of shortages, but at the same time, other areas like California and Texas had a surplus of ventilators, right? So I said, well, why can't they exchange these things? Why should New York have a shortage? Why can't these people ship some of that? And it turned out exactly the point that I made earlier, which is that hospitals, state were competing for limited supplies, they started over-ordering, right? And it turns out that we had a national stockpile, but, and this is where the information system that I mentioned to you earlier, I emailed, in fact, Dr. Halpern, who wrote a report for the Society of Critical Care Medicine about this, right? And he's at the Memorial Sloan Kettering Center in New York City. And his response was, well, we don't have any visibility into where the ventilators are. So we know there are 60,000 ventilators, but we don't know where they are. And if you don't know where they are, you cannot move them around, right? Because there is no national database. So again, you can see it's absolutely critical to have a good information system. It's not enough. For instance, after this disaster, if you recall, General Motors, Ford, everybody got into the business of producing ventilators, right? In May, June of that year. And now we have lots of ventilators in some stockpile. The question is, do we still have visibility into where they are, how much where they are? I'm not sure, not clear yet. That's the challenge, right? You need visibility into where they are, and there has got to be some centralized allocation, right? So the question is, how can healthcare supply chains better prepare for a pandemic? We need to have multiple supply sources, a low-cost global source, because cost is important, but we also need a higher cost local source here in the US. And we need a strategic Federal Reserve, multiple locations with virtual inventory information across the entire supply chain. This is critical, having knowledge of where things are. If you look at any corporation in the US, any large corporation, even small corporations, they have virtual inventory information. In fact, I worked for a project for Johnson & Johnson in 1997, right? This was with disposable contact lenses, where they were implementing information system across the world of inventory of their contact lenses, every warehouse across the world. This was 1997, right? If they can do it, I think the US can do it. I think we have the money to do it. Okay? Visibility into entire supply chain for critical items and better sort of pandemic planning. Okay. And then the long-term impact on supply chains, responsiveness is more important than cost for many critical medical items, right? And the supply chains will remain global because cost is going to be important. The capabilities are spread all across the world, but some domestic production capacity is valuable for critical items, okay? And let me sort of end on that note. Okay, and then I'll open it up for questions.
Professor, I have a question.
Sure.
Do you think the FEMA has modified its behavior at all since last year's crisis? Do you see under the new federal administration more efforts to gain information about location of critical items that could be used for future?
Yeah, it's not clear yet. It's not clear yet that things have improved dramatically. I think there's a lot of coordination going on. Actually, some of that happened even last year. Around June, July, people realized, and there was improvement in some of those aspects. But I personally think there has to be better collaboration between the private sector and the government in this respect, because a lot of the supply chain is controlled by the private sector, right? Because different people manufacture masks, different people manufacture medical supplies, right? And same thing with vaccines, same thing with testing, right? And the question is, how can the private sector and the government collaborate, especially when there are national emergencies like this, right? And I think we have seen better collaboration with the vaccines than what we saw with testing and, with ventilators. And some of that is understandable because kind of the pandemic came, out of the blue, and it takes time, right? But that's where, there has to be sort of some pandemic planning, which, didn't happen. And so there was no collaboration. But I think we're going to see more and more collaboration. And some of this is not really difficult, right? Having good visibility into the inventory, into the supply chain is not very difficult. But it is disappointing that with vaccines, that still didn't happen. I mean, it's not just FEMA, right? Even within California, what the news stories tell us is that there is not good communication and collaboration between the State Department of Health and even the county health departments, right? So if there's no collaboration there, can you imagine how it is with FEMA and all the state health departments and all the private sector? That's a little more challenging.
We have a question in chat from Joel Linda Foreman. They ask, can you comment briefly on the Suez Canal closure and supply chains?
Yeah, so the Suez Canal closure, again, this is an example of what I mentioned about supply uncertainties. It's an example of supply uncertainty where, the Suez Canal was closed for a period. It can be any reason. In this particular case, it was because, the ship got stranded there and they had to dredge and so on and get it out of, move the ship out because it's a relatively narrow canal. And that impacted supply chains because that delayed shipments, because a lot of traffic flows through that, right? And that delayed shipments. And again, as you can see, with whether it's a chip shortage or anything else, it's not the particular event itself, but people worry about, well, is there going to be a 1 week delay or a 2-day delay or a 2-week delay or a 3-week delay? And depending on that, people might then say, well, should I overorder? Should I do something else? And there is a reaction to that, which unfortunately leads to more uncertainty. and more delays. So I think all of that has been sorted out now. And in fact, people reacted in sort of intelligent ways also, which is that people moved, rerouted shipments, right? Instead of going through Europe, they went through other channels. They went to other ports, etc. But this type of supply uncertainty is always going to be there, right? So that's something one has to, and that's why firms carry inventories, right? They carry what is called safety stock or safety buffer to hedge against these uncertainties. So it's not something that we as a consumer are going to be impacted by in a significant fashion.
I have a question. You talk about like a large delivery point, say for vaccines or something that would obviously, per your chart, be more effective. Is there difficulty finding a place large enough with the capacity to get people through in, say, a large metropolitan area like LA? I mean, I went to the Forum. A lot of people are going to Dodger Stadium. They're very big and they seem very efficient. But again, you see times like when I went one time, there was like nobody there. And another time, people waited for several hours. I waited for an hour 20. So I'm wondering about the capacity of these large places and how you can make them efficient.
Yeah. What I would do is not necessarily have these sites which can do 50,000 or 100,000 vaccinations, right? Instead, make it more community-based.
Okay.
But within a community, you don't want 20 different providers, right? Imagine a city of 5,000 people, right? Or if a city has 50,000 people, break it out into 10 distribution points, right? But then within that community of 5,000 or 10,000, whatever it might be, the right amount, right? And that's not difficult to estimate because it can be based upon things like convenience. You don't want people driving, let's say, more than 5 miles. So you may have some criteria, right? Once you have that criteria, you only have one distribution point there. Because the moment you have 10 different distribution points there, which is 1 is 2 hospitals, 3 clinics, 4 pharmacies, right? You're going to have more uncertainty and more supply-demand mismatches.
Right.
So a city of LA, naturally, you will have, with a population of whatever, 3 million, you may have, 30 different points or 100 different points, right? Distribution points.
Do you think that public health organizations that have not been using newer software to keep track of supplies and so on will find ways to improve? Was this enough of a stimulus that you think that the state and county governments will underwrite this kind of modernization for public health organizations?
I desperately hope so. I honestly don't think it costs a lot of money because this is something that I've done with, that I have seen companies use. Even small companies use pretty sophisticated software. It doesn't cost that much. It's something that there are volunteers who do it for the state, literally, right? Set up a great system, okay? It's not difficult to do. If you go to the California State Department of Health and if you look at the vaccine tracker, it's pretty poor. I think a state that's like the 6th largest economy in the world can do better than that.
Sounds a little like the Department of Motor Vehicles.
Yeah. Yeah, I just don't understand it, so.
Yeah.
I think, it's not the money. I think it's the motivation, it's the, I don't know, maybe lack of awareness. And because public health didn't have to deal with too many pandemics, and public health maybe didn't have to deal with supply chains that much. And that's where, like you point out, maybe this will motivate them because of some of the challenges, right? But the reason I wish I was more optimistic, but I'm not entirely optimistic is because I thought after some of the challenges we had with testing and some of the challenges we had with ventilators, I thought there would be better planning for the vaccines because we had 6 to 8 months to plan, but I didn't see that.
Yeah.
Sue, are there any further questions
Um,
in the
I
chat?
don't know. I don't have any in chat. I have a question. In some countries, because there's less capacity, like my native land, Canada, they're making people wait 4 months between vaccines because they're trying to get everybody the one shot. And I think England is doing something like a 2-month thing. And I would assume that that reduces complexity, but it seems like there are some medical problems with that.
That's
So what do
right.
you think about that?
Yeah, I mean, I'm not a public health expert, so I don't want to comment on that
Okay.
aspect of it. I think there are trade-offs there, obviously, right?
Mhm.
And that trade-offs have to be considered in making this. But certainly from a supply chain point of view, right, that's less complexity,
Mhm.
right? Because now you have sort of 2 appointments, and you have to, especially when there are 2 appointments,
Right.
right? It becomes more difficult to manage, right? But honestly, that's not an insurmountable problem. I think if you have good systems in place, and I have not heard of too many cases where people were reluctant to get the second dose or whatever, right? And so once they had the motivation to get the first dose, most people have the motivation to get the second dose.
Right.
So it's more about planning, right? And given those constraints, the question is how well can we plan? That's the way I would say. So the public health, right, authorities should, in fact, that's where a good partnership would have been. The public health authorities, they know all about public health. So they should put some constraints in place. And then it's the supply chain experts, right, who should then say, okay, what is the system we will have that take into account these objectives and constraints? We want to vaccinate so many people by this date. What is the best supply chain system that will accomplish it? And that could have been done, right?
Yeah.
And and this country has the foremost supply chain experts in the world, whether it's in industry or whether in academia. So
Okay, well, actually, Donna has a question like this. Donna Simmons, it says, education, how can your expertise be communicated more broadly to various government entities?
I'm not sure. I think people are aware of universities and the fact that we
Yeah.
work in these areas and do research in these areas. So I think and there are many supply chain centers at many of these universities, right? Which work with industry. For instance, about 5 years ago, I worked with the Port of Los Angeles, right, on a project with a set of students to improve some operations there. So I think I think it's good if there are more such industry and government collaborations. And in fact, it is a California organization. I think I don't recall the name of the organization now. It's a California organization which invited me, right? And they knew about a university, right? They knew about USC, which invited me for that state panel. So,
Jerry, did you want to read the next one?
Well, yeah, I think we'll just do this as the final one. We're sort of at the end of our hour. But Joel and Linda Foreman are asking if you have any ideas on how to manage intra-political competition within local government that disrupt the implementation of these new data systems.
Yeah, I think one of the things that we had proposed, so it turned out that one of my students in the MBA program here about 10 years ago, he is the CEO of the California Medical Association, right, which is a lobbying group on behalf of all the doctor physicians. And he and I came up with sort of a document which he was going to pass along to the state government and some of the state senators, etc., which talked about how you can collaborate and create a kind of state stockpile, right, of medical supplies and coordination within the counties, right, in terms of supply chain, right, with regard to medical supplies, so that the counties can collaborate, which also got into this issue of visibility of information system. Again, we wrote a detailed proposal. I don't know what happened to that after that. I know it was passed along, but I haven't heard anything further. I should also say that it's partly my fault in the sense that I haven't pushed and said, well, what happened to that? So, but we did propose it. So,
Okay, well, we encourage you to follow up on that. Well, thank you so very much, Dr. Rajagopalan, for joining us. These are issues on all of our minds and have been there for the past 14 months or more. And we're very grateful for your insights and willingness to join us today. Thank you very, very much.
Thank you very much for this opportunity. And I love the questions you all asked. And I hope we get to a better place in terms of planning for events like this on the supply chain and the public health side, both in the state and in the US.
Yes, indeed. So do we all. Thank you, sir.
Okay. Have a
All
great
right.
weekend.
Thank you.
Bye-bye.
Bye now.